Okay, so just for the interest of time, I think most people are here now. We are going to go ahead and get started. So welcome back. This is session 4. We're really excited to have all of you here. There's lots of content to go through. We're going to be talking about compensation, how to attract candidates, the culture, everything. So before we move on to the agenda, there was one question that I did want to answer, and this question came in from Deborah in session 2. And she had asked at her health center, there were some, I guess they were having hesitancy with social workers signing contracts as they were moving more into a model of having the behavioral health team reflect the medical care team. So as I had said, I was going through to try to see, talking to the different social workers I know to see why that may have occurred. I really didn't get back a solid answer, as many of the social workers that I know do sign contracts when they're working, in any type of healthcare organization. But I also wanted to bring in Dr. Ogunyemi to just provide more information. And we've had a discussion as well. And I think the biggest thing is looking at what is actually in the contract that may be causing that hesitancy for social workers to sign. But Dr. Ogunyemi, do you want to expand on that before we get started today?
Yes. Good afternoon, everyone. Glad to be back with you all again today. As Michelle and I were talking about that particular scenario, one thing that came to mind was it might be beneficial to look at what exactly the contract is saying, because a lot of health centers have something in their contract that's it's a non-compete clause, and what exactly are like the boundaries of that. Because for some social workers, many of us work another job where we have our private clients and things like that. Does your non-compete clause include that? If it includes that, then you're basically limiting the livelihood of the social worker. So it might be something that needs to be removed or edited in some form of way that it's not only inviting to a new social worker, it's also kind of staying true to, what you value as a health center. I know, also just thinking about also their non-compete clauses that have people that can't work around a particular geographical location of a health center, looking at what that means for people. And I think always when we have barriers with people signing contract, I think it's always good to just survey why. What is the thing that's preventing them from doing so? Because it could just be that individual or individuals, and it doesn't necessarily have to do with the social work workforce as a whole. As we're talking about it, I actually can't think of a time in my journey now where I didn't have to sign some type of contract. So contracts are not new for me. I think the focus should be more about what then is in a contract that's preventing people from signing it.
Yeah, absolutely. And I do know some social workers who work in different healthcare settings who will not stay if they're not able to also practice independently. Mm-hmm. So that's a really, really big, important part of it. So if, like Dr. Ogunyemi said, if that is in the contract, that may be the biggest hindrance. Yeah. To why they're not signing. But yeah, I think all of it goes back to definitely ask your people why. I also wanted to let everyone know Deborah posted on the discussion board a great comment on how as they're recruiting behavioral health providers, they've used the term provider, and their director of integrated care, it says we do have a non-compete, but we're also willing to allow others to work. That's, Deborah, that's probably what it is. Many social workers, they want to have a private practice, and if they're not able to have a private practice, they will not stay at an organization. So I bet you that's where the issue comes in. But as I was saying with what Deborah posted, she mentioned that using the term provider when you're recruiting social workers is not effective, because most social workers don't see themselves as that term, as providers. So that goes back to that language of like really knowing how people identify in their position and ensuring that you are working to promote that. So just, I want to say thank you to Deborah for your question and your comment on the discussion board. Yeah, just wanted to be able to get started with that, and I'll pass it over to Dr. Ogunyemi now.
Thank you so much, Michelle. Yeah, that was a really good question. I know for me, before I started in the primary care world, 6 years ago now, or 7 years ago, not sure, lost track. I didn't see myself as a provider because in school, social workers, in healthcare settings are considered host settings, meaning that those are not settings that social workers traditionally work. So the language of providers is not something that's used in training. So people don't see themselves as that, not until you start working in that particular space and you're like, oh yeah, I am a behavioral health provider, or I am a primary care provider. So yeah, it's definitely something that, I think will continue to, it will change eventually as social work becomes more and more primary care. So for today, our agenda will look at compensation and benefits, organizational culture, and effective candidate interviews, as well as meaningful onboarding. So the basis of our conversation today is how we can attract quality mental health providers. So now we'll move into compensation and benefits. And in terms of benefits, in the next slide, I think as leaders, HR recruiters, and what have you, you need to first understand what is your organization's compensation philosophy. And when we say organization compensation philosophy, it is that formal statement that documents your company's position about employee compensation. It explains why, the why behind employee pay, and creates a framework for consistency. If you're in HR, I'm sure you've had issues at some point with the lack of consistency with the pay grade among different people in your company. So employers use their compensation philosophy to attract, retain, and also motivate employees. Motivation can come in form of, oh, if I stay with this company for a year, this is what a raise looks like for me, or this is what a bonus check looks like for me. So if you have that policy and philosophy in place, it gives people a clearer picture of what your compensation philosophy is. Also, the philosophy is mostly based on many factors, which includes the size of the company, the industry the company is in, healthcare, business, whatever, their market salary information, which I think for social worker, the market salary information is more than likely inaccurate. A lot of the data is inaccurate because social workers, they possess a lot of skills that are not measurable. Right? How can you put I've seen different things where people say, or if you have different skills, it adds like $2,000. Like, let's say you're a behavioral clinician and you do like a particular type of behavioral therapy, that would add $2,000 to your pay. But it's not uniform. People are just doing that on their own. So I think that it's difficult sometimes to be able to kind of pinpoint what that pay grade should look like. So I want to, acknowledge that as it relates to trying to figure it out, because even the one on the internet is inaccurate either. All right. So going into compensation, in terms of compensation, we have to make sure in the next slide that compensation has to be equitable and effective, and it has to be structured in a way that it defines a sustainable approach. Can your company pay this same salary in the next year, and the year after that, and the year after that? What are ways that you can grow the department so you continue to make money and generate money? And when we talk about being equitable, maintaining transparency and fairness too. I shouldn't have a coworker where we have the same experience, but yeah, she's making more money than me. The same experience, the same training, but yeah, she's making more money than me. That has happened because now people talk, millennials talk. I identify with being part of the millennial generation. Millennials talk about their pay. They're not like the other generations that kind of like tight-lipped. Millennials talk about their pay. So, and it shouldn't be that way. And also doing away with using salary history, because a lot of times there is historical impact that has, especially for people of color, people in underrepresented communities like the LGBTQ plus population or women. Asking for salary history, it limits people, right? Because it's not a good indication of their worth per se, but you should have what your own pay grade looks like. And I think, I'm not saying they have it right, but I think a lot of government organizations have kind of like the right idea as it relates to pay. They have the different, I think the federal government use like the G scale, right? They have G9, G10, G11. And for you to qualify for a particular pay grade, you have to have so many qualifications, education, blah, blah, blah. I think
it's the GS scale.
Yeah, a GS scale. Yes.
Yeah.
I
And
think
everybody
they have
knows
the
what
right
everybody else
idea.
is making depending on what the scale is.
Yes, I think that's a skill that many nonprofit and private organizations should probably try to adopt, because for the most part, I think it's fair. Okay, going into the next slide about benefits that are specific to mental health providers. And these are things that you probably already have in place, but you're not advertising it in the way that it's beneficial for your recruitment efforts. Here's why it's important for us to have benefits that are specific to mental health providers. In the next slide, the first one is value. And you can show that your company's invested in the professional growth of your employee. It shows that, the professional growth as well as your personal growth. It can show that your organization values mental health. It shows that you're also able to hire employees that are seen as being competitive in the market, right? That's why it's important for you to have benefits that are specific to mental health providers. In the next slide, I give some specific examples about those benefits. That's clinical supervision. This is probably already something that you do, but you're not highlighting it as a benefit when you're trying to, in your recruitment efforts. Clinical supervision, licensing support, continuing education, and flexible work schedule. Flexible work schedule is something that, yes, it's been talked about in the past, but more now for people, they're looking for that. It's now becoming the norm for people to want to have some type of flexibility in their work schedule if they're going to work for your organization. And this is not just happening in the healthcare space. It's happening in different types of social sectors as well. So the other types of compensation, moving into that, the first thing is clinical supervision. So if we can go like 2 slides down. The next slide. Clinical supervision, and yes, clinical supervision is a formal and disciplined working alliance that is generally, but not necessarily, between a more experienced and a newer or less experienced clinician. In the field of social work, once a person graduates with their master's degree, they then move on into what they call like their clinical supervision period. That is when a social worker has a limited license, and they have to like fulfill certain requirements before they're fully licensed and can practice independently. So if you're looking to hire, let's say, for example, while it is important for you to, it is more beneficial for you to hire someone that's fully licensed. However, if your organization is having challenges with finding, fully licensed clinicians, it may be beneficial to have one fully licensed person on your staff, and then have the other ones be limited licenses, but have the fully licensed person be the clinical supervisor. That means they sign up on their notes and reimbursements and things like that. So if you're looking to hire people that are limited license, clinical supervision could be something that attracts a new candidate, because they're thinking, okay, if I work for this organization, I can get my clinical supervision, because believe it or not, some social workers have to pay out of pocket for that. So that would be a way to attract the candidate that's looking for clinical supervision. And it can, it's not only just beneficial for the clinician in the way that it improves their work and ensuring welfare and things like that. It also, as it relates to like cost, it might be more beneficial for your agency to hire somebody that's limited license, because the pay grade is different. The next type of, going into, I've talked about the licensing requirements on the next slide already, Michelle. I'm just like going through the slides. The next thing I want to talk about is how your organization can support clinical supervision. Assess your readiness and your framework. Do you have somebody on staff? Is your behavioral health, your behavioral director should be fully licensed. Do you have someone on staff that can provide a clinical supervision? And can your organization allow staff the time to be able to do the clinical supervision? Clinical supervision for social workers in Michigan is an hour a week, up to it's been a while ago for me now. It's an hour a week for 2 years, so whatever that total is. Also, asking the candidates that you're hiring or you're looking to hire, what kind of supervision would they need? Because I understand that some HR people don't understand all of those technicalities as it relates to licensure, but asking them what kind of supervision would they need, that can help you be able that can inform you, and you can say, okay, we have a clinical supervisor on staff. That'll be an added benefit if you join our organization. Also recruiting or identifying the lead clinician and supervisor in your organization and allowing them to do so. It's one thing to say you have an identified clinical supervisor. It's another thing for them to be able to do that, because I understand with health centers, people can get, I mean, yesterday I had 12 patients on my schedule. That's an unusual day, but we still made it work. But being able to recognize that they need that time literally carved out of their schedule to be able to perform that clinical supervision. Also providing opportunities for ongoing support for the clinical supervisors as well. Are they allowed to go off, and do trainings to be able to stay current about clinical supervision? All of those things are important. The next type of, the things that I'm talking about right now are like, quote unquote, like the soft benefits, so to speak. Licensing support is another one. That's a benefit that's specific to mental health providers. Mental health providers are looking at that. My company where I work for right now, the health center I work for, they pay for our licensure costs. It's like part of our education costs, which I'll talk about in a minute. So I'm able to like file a, whenever I pay for my license, I submit a reimbursement form and they pay for my license. So that's something that's an added benefit. That doesn't come out of my pocket. Even though it's not a lot of money, it doesn't come out of my pocket. Therapists, mental health providers such as psychologists, therapists, counselors, they need to maintain an active license. I mean, we should already know that. And that license is renewed every 2 to 3 years. I think for social workers, it's 3 years. Psychologists might be 2 years. So for Michigan, I think like the average cost is like $81. But if I know that that's $81, I don't have to worry about every 3 years. That's another added benefit, It's not a big deal, but it is. It's the little things that count, And it just shows that your company cares about people maintaining their license and their professional development. The next thing is continuing education. And this is the only part of our discussion today that I'm going to give a dollar amount suggestion. The reason why I don't say this is a specific dollar amount social workers should earn is because it's different for different states, right? The cost of living in Michigan is different from the cost of living in New York versus California. So you have to find out, what makes sense for you as HR specialists and directors. Find out what makes sense for you. Look at what the median income is and look at the skills and things like that to come to that figure. The only reason why I'm giving this particular figure is because I found that it's been helpful for other cohorts to have a dollar amount to work with. So with continuing education, this is a suggested package that can be offered to your potential candidate. License renewal money can be deducted for the CE package, so people can submit, their licensure cost if you allow them to do that. Also, right now, for me with my current employer, and this is actually true for another FQAC I work for, so maybe it's like a standard in Michigan, I don't know. We have 5 to 7 paid days off annually, outside of vacation or sick time, that is dedicated towards us attending continuing education conferences. And the average is like $1,500 that we get every year. I think it's $1,750 actually, not $1,500. It's like $1,750 that we get every year per provider to cover any type of continuing education expenses. Obviously, we have to show that we actually use that and we just didn't decide to go to Hawaii and just lay on the beach and call that continuing education. We have to show that we use that for continuing education. You have to submit forms and proof that if you actually went for the continuing education conference, you can use that all at once or break them up throughout the year. But it's another added benefit because as a social worker, I need to renew my license every 3 years. And with that renewal comes clinical hours of continuing education credits that I have to submit with my renewal application. So that is something that I don't have to worry about because not only do they pay for the license renewal, they also pay for the education credits that goes along with that. Who doesn't want that? That's attractive to social workers. They don't have to spend that money. And I will tell you, the soft benefit, the soft pay, so to speak, keeps people on the job longer. So find out what exactly it is that you already offer and find ways to maximize that when you're recruiting candidates and when you're interviewing them. I remember when I first started working in the FQAC world, I had no idea that I was applying to a place where tuition reimbursement was a thing. I just saw a job that sounds interesting. And I was like, you know what? Primary care social worker. I wonder what that's about. And I applied because I was leaving the hospital system then. And I found the job, and I think like the first week, my coworker was like, "Do you have student loans?" I was like, "Yeah, that's kind of okay, yeah." And she's like, "Oh, do you know that you can get tuition paid?" I'm glad she said that, because my first I had my student loans paid off that way. And I didn't know that that was even a benefit when I applied for the job. That company didn't post it that that was a benefit. So those things that you already offer, I think it's good to like maximize that and use that to your advantage. Also, your vacation time and your vacation hour. The next thing I want us to talk about is flexible work schedule. And in the next slide, you know, I say that I understand that a lot of health centers, they care about, you know, coverage, and, you know, that's the highest priority for them. However, you know, the low cost strategy and for retention and recruitment is like the work schedule. If you can find ways to really make your work, like make the flexible work schedule attractive for your clinicians, you will see that people wouldn't mind the minor inconveniences, because they will say, "Okay, I just have to deal with that. Okay, whatever. I just have to be on call for a day, but I can be on call from my house." However way you make it seem nice in a way that's it's a mutually beneficial agreement, I think utilizing flexible work schedule is important. Right now, my company is in a phase. Before, they used to care about, you know, you have to like do 8 hours and whatever. They don't care about that anymore per se now. They care about, okay, the work. Are you doing the job? Are you seeing the clients? I would say they're majoring less in minors like they used to do before. You know, they're not majoring in minors anymore. They care more about the patient care versus the numbers, because a lot of times the numbers don't really equate you doing your job. They don't. Yeah, so just having that flexible work schedule. A lot of moms are looking for flexible work schedule. A lot of single people are looking, different people with different lifestyles are looking for flexible work schedule to kind of meet people are not fitting their life into work anymore. They're looking for ways for work to fit into their life. And unfortunately, that is the way of the world right now. In July, I love to watch like little documentaries on YouTube. I learned that in July, I didn't know the actual number, but I was like, oh wow, like millions of people resigned in July. It was recorded that 4 million people resigned in July. And it was dubbed the Great Resignation, which I'm sure you all have heard about, being leaders and HR specialists. It was dubbed the Great Resignation, and it's still going. So we don't even know what the total amount of that looks like right now. But in July, there were 4 million people that resigned. All right, so some specific feedback on how to embrace hybrid and remote work. Update your policies. Your policies and procedures should reflect where your company now stands on hybrid or remote work. Survey staff and see what they need. What would make sense for them? Some people like to come into the clinic. I don't have to go into the clinic every day, but sometimes I choose to go into the clinic because, you know, I have my office and whatnot, and I just want a change of environment. But, you know, survey staff to see what they need, what makes sense for your organization, and be aware of legalities, especially when, you know, with the way work from home has evolved. Like I think I was talking to Deb about this last week. It has opened more opportunities for you to be able to get clinicians, or maybe it was Betsy. It opened up more opportunities for you to hire people out of state, right? So you need to be aware of what those legalities look like for your state, or when you have clinicians that are working across state lines. So be aware of that and update your policies and procedures to reflect that. And also consider what the work from home costs look like. I know last year we all had to start working from home. Many people started using their own, you know, we use our electricity, internet, whatever. Some people had to buy office supplies and things like that. You know, consider offering people stipends for that. I know one organization that I worked for, I teach sociology. They give stipends now at the end of the semester towards whatever cost, whatever it is that we have to pay for working from home. So I think like that's something to look into. Again, that's another attraction for people to want to be able to work for your organization. In the next slide, because of our time, we're moving into organization culture. And we'll look at the different cultures of organizations, the respect for behavioral health team, and the different growth opportunities that may be available. So organizational culture is defined as the shared values, attitudes, and practices that characterize an organization. It is also your company's personality, and it plays a role in a large part in your employees' overall satisfaction. So we'll go into quickly some different organizational culture. The first one is the collaborative or clan culture. For the clan culture organization, their primary focus is mentorship and teamwork. You know, they have the motto of we're in this together, and they're very people oriented and friendly. A collaborative culture is also people focused because they're a company that feels like one big happy family, and it's highly collaborative work environment where every individual is valued and communication is top priority. Some of the benefits of having that type of work culture is employee engagement is high. People feel more connected to one another beyond their workplace. And there's a great possibility for market growth within a collaborative work culture. In the next slide, we have the create work culture, and this is a culture where there's a lot of risk taking and innovation. And you will find this in a lot of tech industries where they risk it all to get the biscuit, like they say. You see with the whole Facebook now metaverse, that kind of a thing. Yeah, that gives an idea of what a create work culture is like. And were you going to say something, Michelle?
No, go ahead. Sorry, yeah.
I saw the yellow box light up. And then we'll move into the market culture or the competitive culture. That is organizational culture where there's a focus on competition and growth. And the defining qualities are stability and control, and their motto is we're in it to win it. I mean, health centers have this type of culture as well to some extent. They competitive culture prioritizes profitability and competition, and their benefits of this type of culture is that companies that boast market cultures are profitable and successful. I see some of that traits with different health centers that I've interacted with, but I think that a lot of health centers are kind of like an integration of different types of cultures. The last one is the control culture, and that's one where there's a lot of stability and structure, and they prefer that their motto is that they prefer things to be done right. Companies with the hierarchical cultures adhere to traditional corporate structure. They're focused on internal organization and by way of clear chain of command. So if your companies with this type of culture, you can't easily access the CEO. You have to go through different, you have to go through your supervisor, and the supervisor has to talk to the administrative assistant to get you an appointment with the CEO. But, with other cultures, you can email the CEO yourself and request a meeting. So that's what a control culture looks like. They follow the chain of command. There's a lot of emphasis on following the chain of command. And the benefits of having this type of culture is that things are done in a well thought out manner, and with internal organization as priority, this type of culture have a clear direction. And sometimes it's rigid, but for the most part, there's a lot of benefits to having that type of rigid structure as well. In the next slide, I want to talk about the respect for the behavioral health team. And I think that this is important, especially when you have social workers in a setting where social workers are otherwise, they're not traditionally known to be in that setting. And I think that this has to come from the top. And what does respect look like? We have, I'm using my experience as an example a lot because I am in this space. We have a provider meeting every month where all the providers come together, and it is required that behavioral health department is a part of it. Sometimes we want to be there, no, but I understand the need to be there because behavioral health providers are part of the primary care providers in a clinic. And I think that's one of the ways, that's one of the efforts that my particular health centers that I work for, that's one of the ways that they instill respect for behavioral health team. Making sure that the other providers see them as a provider as well. A lot of times they talk about physical health care that has little to do with mental health care, even though they're intertwined, but it has little to do with what we actually do day to day. But I see the importance of us being there because it is important. And a lot of times too, we get to educate. I've had, when we used to meet face to face, I would do trainings about common mental health disorders. I would do trainings about patient stress questionnaire or SUD, substance use disorders, with other primary care providers so that they can understand the need for us, and also they can become more comfortable with mental health. Believe it or not, some primary care physicians are not comfortable with mental health referrals or if their patient have mental health issues. So having a behavioral health team that is respected will be beneficial for your organization in the long run as well. I've talked about the in-service and staff participating in daily, weekly huddles. Does your clinic have huddles, like daily or weekly huddles, those quick meetings in the morning? You can put yes or no in the chat box.
Yeah, and everyone can put into the chat box, or they can also unmute themselves. I did want to jump in and say one thing, because this actually reminded me, Adija, when you were talking about the flex schedules. So another thing of really understanding mental health, and I've heard this from some of the clinicians that are here in the DC area where I am, being able to work from home and do telehealth has improved their relationship with their patients who couldn't come in, who had too much anxiety, who were in dangerous situations, whatever it may be. And, you know, having this rigid idea that therapy or any type of mental health needs to happen face to face goes back to really not fully understanding the differences and the changes that take place in the field. So not only is it good to offer the flex work schedules because the newer generation are expecting it, that just is a reality, but also in some ways it also helps the patients and the way the mental health services are provided. So really listen to your staff and what they need, and then ask yourself, if it is rigid in the sense of we won't do flex schedules, is it more that you're really looking at the services for the patients, or is it more of like leadership needing some type of control over the situation? So you have to be really honest with yourself on where that really comes from. So I just wanted to jump in and say that. But Adija, I see people are putting in the chat.
Yeah, I see a lot. I see a few yeses, and Betsy said it's coming to a clinic near you in January. So that's something that will be. I mean, nobody likes meetings, but I especially find the daily huddles to be beneficial because we go through the patients that are coming in for the day. A physician is aware that I need to see that patient when they see them. It just makes for a better day, as opposed you're anticipating the patients coming versus it being like a crisis. So if I know that, oh, I've seen this patient's name on the schedule, I'm already telling Dr. So-and-so, I need to see them once you see them or before you see them. When the patient comes in, we're already on one page, you know? And what do I mean by that? Recently, we had a patient that came in. He's very dramatic. So he came in, this physician had no idea who he was. And obviously he put on a show, quote unquote, for this physician, and she freaked out. And they were calling us and what have you. I was like, so I talked, and he was my patient. I talked to the patient, like, really? And he just had to try his luck, quote unquote, with that particular physician because he wanted Xanax. So it's just like, really? That's what we're doing today? And I can talk like that to my patient because we have an established relationship. So, and that's what that huddle does. When you know that, okay, there's this patient coming in, I know this patient's history very well, I can provide you that feedback. Obviously with telehealth, we don't do that as much because of the barriers with telehealth too, when it comes to like one-on-one interactions with staff, but telehealth has its pros and cons. Going back to what Michelle was saying as far as flexible schedule, I think that being able to work remote should be a part of behavioral health care moving forward. I don't think that it needs to be 5 days a week, but does it need to be maybe 2 days a week? Yes, because there's some patients, I've had several patients, especially during this pandemic, that have shared things with me that they've said they weren't sure they would have if we were face-to-face. Because some people just have a lot of anxiety and they can't really get, to that vulnerable part if they're looking at someone face to face. So I think telehealth needs to stay, but what that looks like for different clinics and communities may vary. And also it's expanded access. We used to have a 40% no-show rate. I don't know what your no-show rate is at your individual clinics, but right now it's about 5 to 10. It's not an issue anymore like it was like a year before the pandemic. Okay, going into the next slide. And that is talking about the career ladders and growth opportunities. People are they will more than likely stay with your organization if there are opportunities for professional growth and advancement. So I say this with a lot of clarity, because I work in a health center, like we've established, and I think there are ways to go about this. So with the health center, I mean, there can only be one behavioral health director, right? How much farther can somebody go up the ladder, so to speak? But I think an approach that could be useful is doing something that the hospitals are doing now, and that's having lead this and lead that. So, and I see that as well within my organization, where even though you cannot be a behavioral health director because it can only be one, what they do is now, after so many years and you've established your specialty, some people come in knowing what their specialties are. Some people build whatever their specialty looks like. You then become the lead for that particular specialty. For example, with my clinic, I am the lead SUD, substance use disorder therapist, right? And then we have the lead social worker that provides services for child and family. Then you have the lead, a psychologist actually, that does marriage and family counseling. Having those type of title incentives in place sometimes, I think, can give people the appearance of what it looks like moving up, the ladder, so to speak. I mean, that's just an idea that I see. A lot of hospitals are using that now, because I'm still affiliated with a hospital in Michigan, and I see a lot of the lead this and lead that coming up. All right, so this is a group discussion that I'd like for us to have. What does the career ladder look like for mental health providers in your organization? Are there any growth opportunities? Maybe you guys have opportunities where people can move up and change titles. I would love to hear what that looks like. And because I see Betsy right here in the box, I'm going to ask Betsy, what does that look like in your organization?
There probably aren't a lot of growth opportunities, but we have been starting to have conversations about that, so that maybe it's a team lead or early intro supervisory role, taking on a special assignment or a project that'll give them a growth experience.
Yeah, I like that. Chantel, what does the career ladder look like for mental health providers in your clinic?
Well, we actually don't have very many mental health providers in our clinic. It's right now we have 3 total. So we just have a mental health director, but our clinic is very open to those types of opportunities because we have leads in other departments.
Mm-hmm. Yeah, I think it's something that health centers should adopt, especially after someone has been with their company for so many years. You can then kind of like incentivize whatever that specialty is by saying, okay, so you're the lead person, you're the go-to person for this or that. Kevin, I'd love to hear from you. What does this look like for your organization?
All right, can you hear me?
Yes.
Great. So I work in a pretty large organization. I work for a large county. So kind of 2 things occur. There's not a lot of movement beyond a behavioral health provider within our clinics. However, if you have the ability and work in a larger organization, there is a lot of lateral movement and upwards movement in other like behavioral health or public health. So that's always, and another thing that I think is helpful when you're communicating to a potential candidate, especially a potential candidate who's new to the area or new to getting their licensure, is that if you do have that experience and you have that knowledge around what the behavioral health and integrated behavioral health landscape look like within your area that the individual is applying, sometimes it can help to just indicate, hey, regardless of how your decision and this interview turns out, and if you choose to take the job or you're decided to be an appropriate person for this job, just know that I'm always available. You can always reach out to me to provide any guidance or assistance in any other agencies that you're applying to, or any other questions you may have new to this area or new to your licensure. Sometimes that can help just in terms of establishing relationships for future candidates, or kind of showing the current candidate that the individual who be supervising you leads with a understanding of what it's like to be in a new landscape.
Very good, very good. Lydia, I would love to, I know we have like 15 minutes left, but I would love to hear from you quickly on your statement in the chat.
Hello.
Hi.
So we first were a large behavioral health organization and then became an FQHC. So we added medical. We kind of did it backwards as most FQHCs have done it, because they are only medical and then they're bringing in or outsourcing mental health. So we did it the other way. Okay. For the mental health, interns have been a great source for us. Some of our interns have become directors. And we do have the upward movement of people very entry level to start on what we call behavioral health paraprofessionals, so very low high school diploma only, okay. To do some care coordination. Then as they either get a degree or meet the experience qualification, the years of qualification, they can become behavioral health technicians and do some case management and do assessments. Some of those employees are on their track to finishing their bachelor's, their master's, and they have like a trajectory that they want to become then associate and then independently licensed. So they are able to, like, literally somebody can come in as a high school diploma and then be able to move all the way up to become a behavioral health consultant once they get their independent license. And some of our therapists, counselors come in through as interns, and then right after they graduate, then they're already working on getting their associate license. And after that, they are qualified to become supervisors.
Okay. Okay.
That's the minimum requirement. And if they get their independent license, then we have 2 roles: behavioral health consultants and commercial counselors, so they can get either of those 2. And a supervisor eventually can become director, and eventually a director can become a chief.
Okay, so there's always like room for growth. And I think the VA has something similar to what you're describing. Yes. And I think that's doable, especially when you have like a large behavioral health department. Thank you so much, Lydia, and everyone that has shared. Going into the next slide, we're going to talk about what effective candidate interviews look like. I think that starts with a user-friendly application process. And you have to be able to remove barriers to entry. I love on LinkedIn, I think many companies should adopt this, where you have the easy apply, where people can just send their resumes and their cover letter, and you can take a look at it and see if you're interested, versus having people fill out an hour worth of application and then they're not even considered for the job. So having like something like that where people can just easily apply can help you can widen your applicant pool, so to speak, and also automating the majority of the process, making sure that people can do that on the internet. They can click on things that they can easily click on to answer, questions. Also, resumes have, they cover 90% of what you need as an HR person to be able to see whether or not a candidate will be a good fit or might be a good fit for a job. So having the resume be something that they upload first, and having a system that can pull information from that to kind of fill in the gaps, and then just have them go in and, you know, fill in other areas that maybe the computer didn't catch. Also, accurate job portrayal is a good one. You know, if you have like we said last week, positively portray your health center, but also be truthful. In the next slide, we talked about another way to for effective candidate interview is to be able to conduct an effective interview, be prepared, ask open questions, make eye contact with the candidate, establish a rapport. Don't start just getting right into the business. Get to know them a little bit so that they can also loosen up and you can loosen up as well. Ask open-ended questions. Listen carefully to their responses, because you will actually get a lot from a candidate by listening carefully to their responses and following up with questions versus just being focused on a question that you have on your paper. Obviously, you want to take notes so that you can go, especially when you're interviewing multiple candidates, so that you can go back and see what, you know, stuck out to you as you talk to different people. In the next slide, I talk about thinking long-term. Candidate interviews involves thinking long-term. You're not just thinking about recruitment, you're thinking about retention, and understanding the specific retention issues your health center is facing can help you focus your recruitment on candidates who might be best fit for your health center. Like I shared last week, someone that, you know, is passionate about improving the health outcomes or specific health outcomes of the population that you work with. Some communities might be more diabetes issues. You might want to make sure that you communicate. You want to make sure that you communicate that in your interview and see if it's a good match for the clinician that you're hiring. Do they care about diabetes? Do they care about STDs? Because some communities, STDs is a big issue for them. So being clear and concise on what your needs are. Recruiting diverse providers can also help you in your recruitment process. You know, partnering with local, this is the next slide, Michelle. Partnering with local universities, investing in training programs, and also having relationships with different schools in your community health centers, having a day where schools can bring in students to like shadow people for a day, and having people be able to, you know, be present to be able to show potential social workers or mental health providers what you do. That encourages people to be more interested in the health center type of work. Also, employee referrals. Encourage your employees to refer people and have incentives for doing so, and have incentives that you follow through on, not just on paper. Some organizations do that. Also, knowing your why. One of the things that, I mean, Michelle and I learned in our doctoral program, in the next slide, was about knowing your why. What is your why? What is your why as an organization? How can you communicate that? Remember that you're recruiting people from different backgrounds. So you want to show your why as an organization and show why you care for diverse population. Also, when you know your why, you have better recruitment efforts and retention efforts. Do you care? You should care about diversity. That should be something that we all care about. How do you communicate that in a way that it makes sense and it's not just like a cookie cutter type of definition that we have on the internet? How do you personalize your care for having diverse providers? Also, when you have people that are diverse, you have better problem solving. You have a team that has better problem solving. You know, there's been times, even before my work in primary care, having a diverse population as it relates to the team members allowed the patients to be served better. You know, there was a patient, I remember when I was working in a nursing home in my earlier years, there was a patient that wanted her hair braided, and she complained about that. And other people couldn't see the point in that, but she's always braided her hair. So, you know, I was able to talk to someone that I was working with, like, can we just spend $20 to like have this lady braid her hair? Like, that would really change something for her. And it did. So having people, you know, on your staff that are diverse can help, you know, educate other staff members as well about what is important to other cultures. You know, working in a hospital setting, I worked in a hospital setting where we had our patient population was predominantly people from Middle East. And because I have a background in understanding like different people's, different cultures and how they interact, I know that when I go to see a patient, in a room, it's not unusual for the patient to even look to the male in the room, and then I have to communicate to the male person in the room. We might personally disagree with that, but that is their culture. So learning how to interact with people from different backgrounds, and when you have staff that is diverse, that further, it just makes your organization a well-rounded organization. Also, be clear on what is important to you. Make sure that you communicate that on your website. Your website is like how you show up in the World Wide Web, right? A lot of us, our website, in the next slide, Michelle, our website needs a facelift. And I hope that we've worked on that, especially in the past year where, we had to rely heavily on technology. I hope that that's something we've worked on or we're working on. Make sure that your website communicates what is important to you, and also that in-person communication, making sure that your individual staff members knows what your organization stands for, because when everybody's on one accord, it communicates the right message to a potential mental health provider. And Michelle knows in the next slide that I love this particular healthcare system in Tennessee. I use them as an example a lot. And I think that we can learn a lot from how I don't think you might see it and say, you know what, they could have done this better. That's always true for anything. But I think that there's a lot that we can learn from Cherokee healthcare system and how they communicate their values, how they communicate what is important to them as it relates to mental health providers, all of those things I think we can benefit from. Michelle, do you want to show it really quickly?
Yeah, let me see if I can share it. So I stopped my video because the red on the screen made my face look very, very weird. So just give me 1 second. Let me pull this up, and I'm gonna have to stop sharing and share again.
Yeah, that's fine.
So, excuse me, everyone. And I wanted to reference one thing because I saw what Maxine wrote about losing a good social worker because of not having that upward movement. And that is incredibly important. And one thing I will say from social workers, and I think you can back this up with the program that we were in our doctoral program, all of the professors push very much your value. I had one professor was like, if your earning potential where you are is not at least 90,000, walk out because you're worth more than that. And we had to take business courses, this idea of solely learning mental health and, as social workers, you need to struggle. And no. The schools are you better make just as much money as any other provider. You fight for your title, you fight for yourself. Here are all the business courses you need to take, along with all your clinical classes. So if you're not offering those opportunities, especially as I know for social workers, just having done that, people are going to leave. So I just wanted to put that out there.
Yes. And to your point, Michelle, a lot of clinicians are now walking into jobs with a better understanding of the business of social work.
Yep, exactly. That's a huge thing of what they're teaching in school now. Yeah, and professors, they will flat out tell you, if you don't get what you want, walk out, because they need you more than you need them. And they're very blunt about it. So this is who's coming into the workforce. So you really have to meet those needs. But sorry, Adisha, go ahead. I know
that is a good point. I feel like today we needed 2 hours. But
I know.
Yeah, this is the website. Please, if you have time later, just look at it and see what are some of the things that they're doing good that you could benefit from. I especially love the tab on professional training. I think that that's one of the things that they do well. They have an integrated care training academy. Did you all know that just in October, HRSA had a grant out for FQACs, behavioral health education organizations that would provide trainings for mental health providers. That is a way for your organization to earn money. You can apply for that grant and have a social worker be the lead person on that grant, and you can create your own training academy. So I would encourage everyone, if you haven't already done so, to sign up for HRSA's grant emails, so you can look at other opportunities, other ways that your agency, your health center can expand what they do. Because I know it takes money to start these programs, right? But you can tap into those things because FQACs are more than likely one of the first organizations that are qualified for a lot of this HRSA grant. So I think that's a great opportunity for you to be able to create this training academy. They have like an internship program. They have like a program where they train behavioral health consultants who are basically people that work in primary care clinic, because they have different titles. Some people call them behavioral health specialists or behavioral health consultants and things like that. Going back into the slide really quickly, I can just talk about it, Michelle. What does meaningful onboarding looks like? Having a pre-boarding meeting, touching base with a candidate maybe a week before they start their new job to get an idea of what their expectations are, and you can make plans for the first day. Send them a quick survey so you kind of get an idea of what they already know. For example, when I started this new role, I was already very well versed with using the electronic medical records. So they didn't need to spend 2 weeks teaching me how to use it because I know how to use it. It just helps you know how to start, and also adjusting your onboarding content in the next slide, Michelle, through through the learning styles, the skills, and the interests of your providers. And also making sure in the next slide that you make your new hires a priority. Create a schedule. Make sure that the preceptor is aware that you have a new person starting, because that happens where people are not aware. Treat onboarding like a meeting, making sure they block out time in their schedule to be able to provide that onboarding, and consider onboarding a team initiative. We have a new person on staff starting today. Everyone, please welcome them, introduce yourself. Having that preliminary work before they come in will be great for the onboarding process. So that is about it. I know we had a lot of information today, so I appreciate you all for your engagement and sharing some of your feedback with that. So over to you, Michelle. Right.
Yeah. Thank you so much. I know there was a lot of information today. We just really wanted to give you as much of that recruitment ladder as we could. We do have one more session left. We're going to do a case study. There'll be assignments. So please reach out to me if you have any questions about any of this. As I said, I know that this was a lot of information. Really appreciate all of you staying here with us for a few extra minutes. If you could complete the survey that popped up, we would really appreciate that. And as well, if you have any specific questions that are social work related, I think both Dr. Ogunyemi and myself, having gone through that, and that is the field that we were educated in and we work in, we can definitely provide some insight into that. So definitely happy to provide any of that, but I hope everyone just has a wonderful day.
Thank you.